Hi, this is Louise, and Louise, can you just tell us how old you are?
50.
Okay, so we've been through Louise's medical history. The only issue that she's got is diabetes, but it's all well controlled, so there's no issues for us to carry on with the procedure. Louise has come in because she's got some concerns about smokers' lines. Okay, so Louise used to be a smoker, and we can call them smokers' lines, but you have to be careful when you call them smokers' lines to people that don't smoke. Okay, so if you use the phrase barcode lines, okay, it might be a little bit more better. Okay, and so she's got some lines down here. So what we're going to do, we're going to try and treat these with some soft filler. Okay, we've got to remember when we do the upper white lip area, okay, we don't turn them into a chimpanzee. Okay, we don't want too much of a convection here. Okay, that basically gives them a chimpanzee's upper lip. So you want a nice, the rheology of the filler needs to be, the viscosity, the viscoelasticity needs to be good really and proper, because we're going to go superficial with this. But we're also going to subsize with a cannula around this area as well to try and break up these areas where the lines are deepest. Okay. She's got a little scar in here where she used to have a, what is it?
Piercing.
A piercing, okay, well many years ago. So what it is, we're going to try and subsize underneath that as well and see if we can lift that, maybe put a bit of filler. But you might even see a little bit of filler come out of there if she's still got a hole present, okay. If she has, then there's not a lot we're going to be able to do with it, okay. So again, we're going to cleanse the area. Louise has got a little bit of bronzing powder on, okay, so we're going to make sure that's all off, because basically what can happen is, as we all know, we start making holes there, we can actually cause infection, because that bronzing powder could get underneath the skin and then cause really serious problems, especially when there's filler in there. So we're going to make sure that it is completely spotless and clean. Cleanliness is next to godliness, as they say. So again, like I said before, we've got to be careful of and know your anatomy in everything you do when it comes to injections, okay? And we've got to make sure that the main facial artery that comes up about here, okay? Tortuous root comes up here, okay? But you've got about a centimetre gap here where you've got a play area, okay, a safe area, okay? But then again, you've got to be careful, not safe. But it's quite deep in this area, so we're going to be going superficial with the cannula, okay, and superficial with the injection, with the hole that we make for the cannula to go in. Okay, and head back on me, Louise, nice and relaxed, okay. So a little sharp scratch coming up, Louise, okay. So bevel up, in, okay, and straight out. And of course, if you have got a little bit of blood there, give it a wipe, because you might find it difficult to get the cannula in if there's a little bit of pressure with the bleeding. But in this case, it's absolutely fine. So, nice and relaxed for me. Okay. Okay, so we're in. Okay. Now, Louise will feel a little bit of pulling and stretching of the skin. Okay. But what we're going to do is a little pencil technique. And we're going to bring the skin back and then bring it onto the cannula. Okay. So, skin back onto the cannula. Okay. That way we're getting in. You can see how superficial it is. You can actually see the cannula. Okay. And what we're going to do now, as we project the cannula forward, we're going to feel where the tip is. Remember, you've got the central point here, and you're not going to get that. It's going to be painful when you actually hit that, okay? So we're going to put a little bit of filler in there. You can actually, and then linear thread it, okay? Now, I'm putting a little bit of filler in, quite simply, right, just to numb the area, okay? So a little tiny bits of filler to begin with, and then what we can actually do, we can start subsizing the area, okay? So you actually see, I don't know how close you can get with that, but you can actually see the area get subsided. Now this is where we're hitting the actual scar tissue here. You can see where it's puckering the skin. Okay, now to get that and maybe do it properly, we'd need a needle really, and I'm not prepared to do that because I don't think it warrants the problems that it may cause. Okay, so we're trying to subside. Is that painful at all, Louise?
No.
Okay. But as I say, you can see the puckering going on there, and that's the scar tissue there underneath the skin. So we're broken up a little bit, okay? So we're getting through, there you go. So you can see the cannula now there, okay? And we broke that up a little bit. So we're going to deposit a little bit of filler there, okay? Now will it make a big difference to you? Obviously, products you can use to help to get rid of that, but in this case we're going to concentrate more on the barcode lines. Okay. And already you can see them lifting nicely. Okay. Always remember, stop injecting before you take the cannula out. Why? Because if you're using a heavy product, what you don't want to do is bring that heavy product to the surface here, okay? It can cause problems. It might not get circulated properly into the skin, and it will cause problems. And the other thing is, if it comes out of there, you're wasting product, okay? And that's the last thing you want to do. So I tend to just roll it around with my finger, okay? Because you're going to use the small amount of product, there's no need to go mad in this area. You can always bring them back and redo it and put more in. But if you try to put too much in one go, it can cause serious problems. As I say, it can give a very horrible look to the upper white lip area. And no one's to look at like a chimpanzee.
No.
Okay. So nice and relax again, Louise. Again, sharp scratch coming up. Okay, well done. Okay, a little bit of bleeding on this side, but not too much. Okay, so nice and easy. As I say, you can put a little, deposit a little bit of filler as you're going in. Okay, by doing that, you put a little bit of lignocaine in there with the filler, and obviously you make it a little bit easier for the patient. Okay, so you can see the tip of the cannula there, you can see it just blanching the skin, and that's what you want, that's the depth that you want with this sort of filler. The rheology of this filler allows you to be extremely superficial. Okay, now we're being in there with the deposited some filler, so we can actually do that subsize a bit now, okay, and we can try and break up all that area. I tend to lift the cannula a little bit, as you can see the tip. Okay. And then once that's done, you can deposit a little bit of filler in there. And there you go, it's all done. Okay, so basically that's the technique that we use with a cannula. Okay, now you can use a flat blanching technique. There's certain fillers that will allow you to go in with a needle, flat blanching against the skin, okay, and then in underneath the actual wrinkle, and you can just deposit little bits of filler like that. With the deeper lines, you might have to do that. Okay, some people will actually go in and go underneath the lines and things like that, and actually do linear threads and all. So there's different methods to do, but we thought we'd show you the safest method, and that's with the cannula. Okay, we believe this is the best way of doing it. That's my way of doing it. Okay, and as I say, I think you can see a big improvement already, and that's just with 0.8 of a mil of S we've used from the Stylish range. Okay, by Vivacity, and it's one of the softest products that they use. This is a wonderful product as well for the lips as well. Okay, we can actually do the vermilion border. We can rehydrate older lips with this product as well. It's an absolutely wonderful product. It's a go-to product for a lot of things. We can actually use it in the eyebrow for eyebrow lifts, for lifting the eyebrow, okay, and we can actually use it, as I say, in lips on maybe more mature lips, okay, more mature ladies, okay. In this case, I don't think we'd use it on Louise if she wanted a lips too. We'll probably use a more firmer product really. But she's got great lips anyway, but we won't go down that route because she's not as filmed if you don't. She probably will do after she's seen how good this is like.
Yeah.
Okay, so what we'll do, I mean, if you did go around the vermilion border, you've got some little lines here actually in the lips. So if you went around a vermilion border, you could actually eliminate them as well. But a vermilion border is not a thing that I do a lot now these days. What I tend to do is just go a millimetre below the vermilion border and actually deposit some filler there, okay? You get less chance of migration then into the white area, okay? So, but as I say, and I say, it all depends on what they present with and how they're presenting. That will dictate what your filler you're going to use. Because the rheology of the filler is important and it dictates at what level you're going to be using it at. But in this case, as I say, a nice soft filler that flows absolutely lovely, that will flow into the skin, integrate well into the skin, deposit the hyaluronic acid, which is we want, and a 80% improvement, okay, and the rest of the 20% is when they draw the water in, okay, and it lifts it, and hopefully we'll get 100% correction from there. Okay, so aftercare, okay, any pain, any discomfort, if you get anything like that, then you need to be calling me on the emergency number straight away. That pain, I'm talking about that sharp pain, that really bad pain, okay, really like toothache, earache pain. We'll get a little bit of sort of tenderness after we've done this because we've been in with a cannula and we've poked around in there, you know what I mean? Oh, a little bit of paracetamol, and that's just a simple medication that only deal with simple problems. If the problem is still there after you've taken an hour after you've taken the medication, then we know it's a little bit more serious, so you need to be calling me. Any blanching areas on the face, any white areas, okay, again you need to be calling me and bringing me back in, and we'll have a little look here. And also any numbness, continuing numbness, okay, lasting 2 or 3 hours, then you need to be coming in and need to checking that out. I don't foresee any problems or issues or concerns, but at least if you've got that information and it does happen, you know to call me straight away. So have you got any questions?
Yeah, no.
You're all right with that? Okay. So first of all, what I'm going to do is just give you the mirror before you go, and you can have a little look at what we've done and tell me what you think.
Oh, wow. Looks amazing.
It does, yeah. And this is just the first time, Louise, as I said.
I know.
We don't want to be up at the top the first time we do it. What we want to do, we want to make sure that, you know, there's still a few lines here that we'd probably work on, but what we want to do is see how that works and see how that settles in, okay? Because if we went in there now with needles and we tried to do that, you know, we could make it look a little bit too puffed up, you know what I mean? So we'll take it one step at a time and then we'll bring it back in 2 or 3 weeks' time, we'll have a little look, and that's what we do to correct it anymore, then we will do.
Yeah,
Okay,
thanks,
right.
Neil.
You're welcome.
Thanks very much.